Hello, thank you for joining. Yes, that's great. Thank you. Thank you for joining today. I'm delighted to be chairing this webinar about becoming an RCN rep and workforce champion. The RCN is the world's largest nursing trade union and professional body. So we exist to support and empower 500,000 members to be the best nursing professionals they can be and to work fair and in fair and healthy workplaces so that they can focus on what's important, delivering high quality evidence-based care for patients. Our expertise covers all areas of nursing, from professional practice and policy to clinical standards and employment relations. This puts us in a unique position to shape the profession, to influence policymakers, and to support and empower hundreds of thousands of nursing staff who are delivering care. So I'm going to start a little bit about myself. So I came to the UK in 2011 from Kerala in India after qualifying, and I've worked as a critical care nurse ever since. In the last 14 years, I've been working on different platforms to support and raise the profile of internationally educated nurses and support workers. And I am currently a senior nurse at University College London Hospitals, and um, I would like to say a bit about my family too. My wife is a nurse, and my sister and my brother-in-law are also nurses. So we all have taken the journey of internationally educated nurses and their struggles in the UK. So nursing is not just who I am. Um, it is everything that I do. And I have always been interested in standing up to the rights, standing up for the rights of nursing professionals. But my journey to becoming ASEAN president really started during the strike action. And I felt the nurses were not getting the justice they deserve. And I wanted to make sure the voice of my colleagues were heard and included in the important conversations. I feel strongly that nurses should be paid fairly for their work, that internationally educated nurses should be supported in the workforce, that difficult conversations around things like abuse of migrant nurses in the independent sector are brought to the fore. In my time as president, my ultimate aim is that I want to help us to achieve pay justice for nurses. And I want to do everything I can to ensure the voices of our members are heard loudly by governments and other decision makers. To do that, I want to make sure all members, particularly internationally educated nursing staff, are engaged with the college. So we have a stronger, united voice. And that is what we are here to discuss and learn about today. The nursing profession will be made stronger by getting internationally educated members unionized and organized and empowered to act. Today's session will explain how you can help to drive meaningful change for nursing staff and patients through becoming an ASEAN representative and workforce champion. So you will hear about organizing for nursing profession as well as receiving an overview of the benefits of joining and contributing to ASEAN professional forums. So let's start by introducing our first speaker, Lena Johnson, ASEAN professional lead for nursing workforce, who will be giving us an introduction to the ASEAN workforce standards. Thank you. Welcome, Lena Johnson.
Thank you. Thank you very much, Bejoy, and really lovely to be with you tonight. Next slide, please. So today I'm going to briefly talk to you about our nursing workforce standards. And the aim of the standards is really to support you, our nursing workforce, to be safe and effective. Within these sets of standards, what we've done is talk to organizations to tell them what is the roadmap to getting a safe and effective workforce. Next slide, please. And as I said before, our standards set out what is required to secure a nursing workforce that is able to deliver safe. And safety is really important, and we'll touch on some of the points around making sure you have the right numbers, but also the skills are important in delivering that effectiveness and being able to deliver compassionate, person-centered care as well. So our standards, we've launched them in 2021, and we've just updated them in this May 25. And this is the first session I'm doing to introduce them to our wider membership. So thank you. Next slide, please. In terms of where do we use the standards, so anywhere you work across the UK, you can use the standards. So if you work in a hospital, in a care home, regardless of which patient groups you're supporting or clients, if you work with children, patients with mental health or learning disability, you are able to use our standards to support you at work. And I can see some colleagues are coming from Wales. So wherever you are in the UK, you can use it. And where you have safe staffing legislation, our standards do not work against them, they work with them. And we go into more detail around what else is in the package around the standards. Next slide, please. So who are they designed for to use? And is everyone involved in nursing services? So again, starting from those who funded, those who contracted, and definitely those who deliver it. And on this slide, you can see a resounding you as a professional. There's the expectation for you to use our standards to support you at your workplace, but also to really support what you deliver in terms of patient care. It does allow managers, boards, nurse leaders, all of them to think about actually what do we need to do for our workforce to support them and to be able to deliver better care for our patients and clients as well. So including regulators. So if you are across the UK, we're working with regulators so that they can understand these are the standards we set as a Royal College. And we expect that when they go to inspect areas, they're asking about how are you treating your staff? Are they getting the right support to be able to deliver the best care our population needs? Next slide, please. So we have responsibility and accountability, which is the first theme of the standards. And what that does, it ensures that we are talking to the people who hold the money in terms of budgeting. You might want to have the right staff, but if it is not funded appropriately, then you'll always struggle. So within the standard one, we're looking at the chief nurse or the most senior nurse in the organization is responsible for deciding the numbers. Then the whole board are accountable because we need the whole board to be on board to be able to fund that appropriately. In two, we think about how do we fund it? It should be based on what we want to deliver. So if you want to deliver 24-hour service with high quality nursing intervention, you need to fund that appropriately. And in three, we look at how you make sure that services still keep going, even if you have a critical incident or events. And I was talking earlier with a colleague around example, what happened over the weekend in Liverpool. We expect that our health and social care, especially IENs, to be able to react appropriately. So business planning is really important in standard 3 to make sure that you know what to do if there's an emergency, if there's a climate incident, you are aware at your workplace level, and this is reviewed annually as well. And in 4, an important aspect of recruitment retention, and Bejoy already spoke about that, the need to be able to pay people fairly and recognize the skills, knowledge, and expertise that they bring to this profession. But most importantly as well, that the terms are fair and the conditions of work are fair as well. Next slide, please. So when you're thinking about, do we have the right staffing levels in your organizations? And this is not just for nurse leaders, this is for everyone to start to have an awareness. These are the safety markers that are available within our standards to tell you that maybe your staffing is not right. If your vacancy is really high, what you find is if you don't have enough staff, more staff leave. So it has a kind of a negative vicious cycle. How many staff are you using that are not substantive? Are you using a lot of bank and agency? Are you moving your staff every day around in the organization to fill gaps? Are you asking your staff to really work extra hours, unpaid usually, and doing more and more benches because you don't have enough staff to cover? So within these red flags, it's really important that you start to get to know about these and you can ask questions. So what we see, sickness rates also go up, and also staff disciplinaries tend to happen. Tired staff who are working with a wider number of patient caseload, they tend to unfortunately have a negative impact on the risk of errors. So when you see disciplinaries going up, that could also be an indication that actually there is a fundamental issues with your staffing levels. Next slide, please. So 4 is really, again, an interesting one, which we've introduced in our updated standards, that you, especially if you come in from abroad where you don't have trade union membership or that is something frowned upon, we are saying it very clearly within our standards. Yeah, you have a right to join a trade union or professional body like us, and that this should be something that is made available, this information to you when you go on induction. So my take home today will be, when you go back to your workplace, if you're not a member, use that QR code and join us. And if you are a member, how do you ensure that when colleagues come from abroad, join in your workplace, that they know that right to union membership is available for them? Next slide, please. So our second theme looks at clinical leadership and safety, and is quite vast. It looks at how you deliver care. So the team that is apparently actually delivering care to patients. So it starts from having a leader in that place. And we are saying in these standards, you must have a registered nurse lead. We are not apologetic about that. I think it's very important that registered nurses lead teams. We, again, avoiding the substitution work that's happening, that maybe your manager is not a registered nurse. So your question will be, how do you get your supervision, your reflection? How do you get revalidation ready if your manager is not a registered nurse? And our standards can help you with those conversations. In 6, we talk about the role of the nurse leader. Again, it's really important as we see more progress and see more of our colleagues from the global majority progress into leadership roles. It's even more important that you are out of the numbers to be able to support your team. In 7, we look at the CPD offer and making sure that that's available to you and you're supported to access that in order to gain those promotions and progress. And in 8, we talk about how much headroom you need to have within your establishment. And this is about the extra funding that allows you to have your annual leave without fighting. It allows you to be able to, again, do plan things like your study days, but also if you're sick, you can have that time off. And in 9, we look at the substantive workforce. And the substantive workforce are the permanent staff to that place. We need to have a good balance that when we are looking after patients, the majority of the staff are permanent to that area, because that gives that advantage that they know the patients, they know the area, and they can support new people coming through. And in 10, it's a very important standard. We look at scope of practice. And within this update, we've talked about the role of substitution, that registered nurses must never be substituted within that standard. Next slide, please. So when we talk about the role of the leader, when they're supernumerary, these are the expectations, some of the things they should be doing, involving all our pillars of nursing, in research, education, in leadership and management, and also clinical. But these leaders need to be accessible for their workforce to get support and also to develop and innovate. So these are the things that if you are a ward manager on the call, you should be thinking about in your work plan. Do we have this? If you manage a home, are you doing all of these aspects as part of your role? And you must be given time to do that properly as well. Next slide, please. This slide is very busy and we'll make sure you have access to the slides. But in thinking about your CPD, I know we banter that word around a lot. What is CPD? What does that mean? It's not just about mandatory training or statutory training. It's a training that should enable you to develop professionally and personally as well. And within the standards, we've put some roadmaps around the things you should be talking about when you have your appraisal, and asking about support and making sure that this is actually funded properly. And one of our asks within the standards is to make sure when you access training and development for work purposes, it should be done within work hours. And when that's not possible, you should be either paid overtime to do that outside or be given extra time off because you've done that work when it's not possible to do it within work hours. Next slide, please. We talked about the uplift earlier in Standard 8, and these are the things that organizations need to budget for so that you can do your work properly. So again, annual leave, we know that's a big issue with our internationally educated colleagues, that you want to take your leave more or less all together to be able to go home because you live in a different continent, for example. Flexibility in annual leave is something we'll talk about in Standard 11. But again, making sure there is enough budget will allow for all these things that are part of life to happen for our workforce in general. Next slide, please. So redeployment is a massive area, and we've acknowledged that this is what is used to cover staffing gaps across the whole of our workforce. People are being moved on a daily basis, and I definitely have experience of this happening to some of my team members, that every shift they've been asked to move to another ward that they don't know much about, they don't have the competence or confidence to be in. So within our standards, we've really elaborated on this issue around redeployment. One of the expectation is that, and we've actually put it down, you shouldn't be expected to take charge of an area that you don't normally work in, you don't feel confident or competent in working at as well. So all of those elements, treating everyone with kindness that comes to your area, or if you moved around, your staff well-being and psychological safety is really important to make sure that when you go onto another department, you can do really well and thrive. Next slide, please. So enhancing corpus practice, again, this is super important for our colleagues that are trained overseas to come into the UK. We know there is always an adjustment period that's needed. It doesn't matter how many years experience you have. If you move to another ward or department, even I'm a respiratory specialist nurse. If you move me into a cardiology ward, I'm not the same nurse. I'll need time and adjustments. So it's really important that everyone has a right for supernumerary time when they move into a new area, and they have a structured induction that is really aimed at what they need rather than this is the format for everybody. We need to start to think and treat people like individuals and give them that support so that their scope of practice will be up to date and they can practice the best possible. But within all of these, you can see these are the things you need to be asking if you move to an area. Even if you have a promotion, your scope of practice will change. Moving from a band 6 to a band 7 or 7 to 8, you will have to readjust. So everybody needs to have that structured induction and support when they move up or across as well. Next slide, please. And the last theme talks about health, safety, and well-being. And it's really important that we look after our staff. If we don't look after our staff, we can't bank that they will do that for our patients. And this is a sad reality. Every time there's a health and care crisis or scandal, what we see is the staff have not been looked after. And this is something our standards bring that's different when we talk about safe staffing. We also talk about the right support that staff need to have. Next slide, please. So on a practical level, your rota is part of how you get to balance your own life and making sure that you can also have other aspects of your life that are important to you really looked after. So any shifts over 8 hours is considered a long day. It's not just a 12 hours or 11 and a half. According to the health and safety legislation, that is a long day. So you need to be having conversations around how you keep yourself safe, how you don't do too many back-to-back shifts, and how you recover after your shifts as well. In rosters, we need to think about the right skills so that people are not doing the wrong things, and it is also touched on in scope of practice. If you've just come into the UK, even though you're a qualified nurse, you also need to be protected to make sure that while you're doing your transition to do the PIN, you're not exposed to be in a position that you have to act like a registered nurse before your PIN. So the right skill mix is really important. When do you get your roster? Again, within the standards, we're very clear. 8 weeks in advance is a reasonable time for people to get their rosters, to plan their lives. And I already spoke about that flexibility around annual leave. Your annual leave is the only annual leave you get. Employers should be supporting you to use it to what's best for you, not just what is best for the service. And working with colleagues in a different way can allow people to have more time off, because you're not going to get any extra time, or you just work differently when you come back. And also, when you miss a break, that's a red flag. Reasonable adjustment should be there for our colleagues that are disabled, pregnant, or have some health and care needs that need to be looked at. So you are really supporting people through the rota. Next slide, please. Again, inclusive workplaces, that's what we hear a lot, but what does that mean in practice? And within our standards, we try to signpost you to what good looks like. So making sure that everyone has EDI training is a basic, I think, for everyone should be able to understand difference and work together and collaborate and learn from each other. And understanding the workforce that you have is really important. And for our colleagues on this call, how people are recruited ethically is very important. Bejoy spoke about exploitation. But again, knowing your rights and what good looks like is really presented within our standards. And definitely the equitable access to CPD is something we have specifically mentioned in these standards as well. Next slide, please. What does your workplace look like? Do you have a break room? Do you have a changing room? Do you have facilities to be able to lock away your own property when you are at work? If you're a new mom who's just returned to work, asking for these things. We are saying within our standards, these are basic things that employers should provide. What do you do when you want to express? Do you feel like you're having to go to the toilet? There's nowhere to keep your milk. So again, these are fundamental things. A workforce that is 90% female, we should expect every employer to be thinking about these facilities, right equipment to be able to do your job, keeping you safe when you work alone or you're driving or work in the community. These are all expectations within Standard 13 around health, safety, and well-being. Next slide, please. On this slide, we look at all the barrage of things they should be having in your workplace to keep you well and really maintain your well-being. Again, drinking water might be something basic, but we do hear colleagues that actually there is no drinking water in their break room because they don't have a break room. They sit in the assistant's office to have a break because there's nowhere else, no room in the inn. So it's really important that you get familiar with our standards, because we're spelling it out to say, this is what you need to be able to deliver safe and effective care. And now it's up to your employer to do this. And with our work on the standard champion should help you to be able to have that conversation differently, rather than saying, oh, Lena says, or I am saying I need this. You could go back and say the Royal College of Nursing say, as a nursing support worker or as a registered nurse, I need access to something basic like drinking water, which is part of the Health and Safety Act, actually. But we are really bringing it all in one place for you to have access to that. Next slide, please. So Sanjit will be talking to you shortly about the work of our champions, and absolutely an important step in terms of getting you more active in the college is an avenue for you to be able to do something locally in your workplace to make an improvement. So we talk about a few things across the slides, but what can you go away and do right now and start that project is really important. And we have a wonderful badge that you will get as a champion. And this is a lovely picture of our event where we bring our champions together on a regular basis to really celebrate what they're doing locally. Next slide. And again, this is the role of the standard champions, and Sanjit will talk to you more about that, but that's just an outline. And our vision for this work is to have a standard champion in every workplace where we have an RCN members, because if our members know what are their rights and what is the expectation, they can push back, and with our support, they can really make beneficial change for their workforce. Next slide, please. we have some checklists that we've designed, and we'll share that in the chat shortly. And this really starts to think about health, safety, and well-being. You can go back to your workplace and you can do this, looking at what happens to me at work. And then you can go from there to say, if something is not happening that we say is the right thing to support you, then what can you do about it in terms of becoming a champion is the next slide, please. And again, to become a champion, you review the checklist, you identify something that is not happening in your workplace, and then working with your line manager and colleagues, you do something about that. And that could be a small project or a big project. Once you've completed your project, you come back and tell us about it by filling in your self-nomination form. And once we ratify you, you become part of the Standard Champion Network. And the only ask is to come to a meeting 4 times a year where you meet other champions across the UK. Next slide. And here are some videos we have for some of our champions, and that's the QR code to sign up, but you will have access to this slide. So I'll hand over to Sanjit now. Thank you very much. And we got our webpage again. I think Harry kindly put the link in the chat to tell you all about this work. And it's a very short time to tell you everything about the standards. But hopefully, if you have any questions, we're here and we have the Q&A time. Thank you very much.
Thank you, Lena. Am I audible?
Yes.
Yes.
Yeah. Thank you. So hello, everyone, and thank you for joining us this evening. And thank you, Lena, for the detailed presentation, which makes my life easier. So today, I'm sharing why becoming an RCN workforce standards champion can be truly transformational for you, your your colleagues, and your workplace. Next slide, please. Thank you. So before beginning, a little bit introduction about me. I'm Sanjit Kumar Nair, and I wear a few hats within RCN and NHS. My core role is I work as a clinical placement facilitator at Lancashire Teaching Hospital, where I support the next generation of nurses, ensuring their learning environments are safe, inclusive, and enriching. I'm also proud to serve as a RCN learning rep and change maker, helping shape workplace culture, influence education policy, and advocate for staff well-being. At a regional and national level, I am the chair of ASEAN Northwest Regional Board and vice chair of England's Chairs Group, which allow me to connect frontline insights with the wider strategic priorities. And finally, I'm honored to be a regional fellow for the Chief Nursing Officers and Chief Midwifery Officers BMA Strategic Advisory Group, working to champion equity, inclusion, and representation across the system. These roles gave me a unique perspective, one grounded in real world practice, but connected to policy, people, and progress. Next slide, please. So, first of all, what are RCN workforce standards? The RCN workforce standards are practical, evidence based principles. They ensure the right number of staff in the right roles with the right support. There are 3 core pillars: responsibility and accountability, clinical leadership and safety, health, safety, and well being, which Lena detailed in the previous presentation. What it means, these help organizations create conditions for safe, effective care. Next slide, please. So, who are workforce standards champions? Champions are connectors, bridging policy and practice. We advocate for standards that makes work life easier, safer, fairer, and more sustainable. We are not managers or inspectors. We are trusted colleagues who raise the bar together. Next slide, please. Now, we can look some of the benefits this role can bring to you. In my perspective, for me, being a champion has meant growing in confidence as a leader and advocate, gaining recognition for championing quality and safety, building a network across the UK, and most importantly, feeling that I have contributed to better outcome for both staff and patients. It's incredibly rewarding, personally and professionally. Next slide, please. What are the benefits to your organization? When workforce standards are championed well, the workplace sees real impact in terms of better patient outcome through safer staffing, staff morale improves, leading to better retention. Organizations develop a culture of continuous improvement, and they are better prepared for regulatory visits from CQC or NHS England. Everyone benefits when we invest in workforce well-being. Next slide, please. So what do champions actually do? We deliver awareness sessions, help implement the standards on the ground, share best practices, work closely with the unions and management to escalate concerns and support change. You don't have to be perfect. You just need to be committed and curious. Next slide, please.
Sanjit, do you want to turn your camera on?
Oh, sorry.
That's okay.
Sorry, I didn't know that my camera was. Yeah.
That's okay.
So how to get involved? It's easy to get started. Visit the RCN website, speak with your local RCN rep, join the induction and support networks, and I can assure you will never be alone. You will be a part of supportive, growing community. And I guess moderators will put the links to join in the chat. Next slide, please. So I'll leave you with this. Before finishing, I'll leave you with one question. What one thing you will do differently after today? Whether it's signing up, speaking out, or simply reflecting, you have a voice that matters. Thank you for listening, and I would love to hear your thoughts and questions later on. And I will hand over to our next speaker, Carmel O'Boyle, Chair of RCN Council. Thank you.
Thank you very much, Sanjit. And as Sanjit has said, if you've got any questions for us, there's a Q&A tab, and you can pop your questions in there, and we can have a look at those later and see what we can answer for you. So nice to see you today, and thank you very much for joining us. As Sanjit said, my name's Carmel. I'm chair of RCN Council, and I've had a bit of a kind of whirlwind career in the RCN as I started. As many people did as a student, and then I kind of got involved as a steward, and then became branch secretary and then chair, and then I went to the board and became chair of the board, and now I'm in council, and I've handed our board over to the very capable hands of Sanjit. So thank you very much. So as I've said, I'm a steward, and there are several different ways of representing your colleagues in the workplace, and there's various different things. So a steward has several responsibilities. So we signpost and we give advice and guidance to people. We act as a liaison between members in the union, promoting fair treatment and working collaboratively with employers and other stakeholders. And we kind of form a community in my own trust. There's kind of a WhatsApp group and a Teams channel that we have with all of our reps, and we meet regularly to discuss what's happening in our trust, and then we feed that into branch, and so we can kind of understand what's happening across our wider area. So there's some of the things that we do is that we signpost. We represent members in more formal procedures like disciplinaries and grievances, and that's about us making sure that there's fair treatment, that our trust policies and procedures are always followed, and that members kind of sometimes need that helping hand to guide them through things. And everybody needs a friend, and I like that our representatives can do that for each other. But it's about as well being that person, again with the workforce standards, that promotes excellence within our trusts and within everything that we do. And if you are not happy at work, I believe that you can't give your best work, you can't give your all to your patients. And so being an RCN representative is nursing our nursing family. We build relationships with staff side, and we work across all of the different unions that we have. Certainly in my own trust, there's several of us, and we all represent a different group of people, but we come together to make sure that all our members are treated fairly. And through those things, we can influence change by looking at policies and procedures that the trust have gone and putting our input into there. It's about building those relationships and working well with people, and it's about developing our membership. And I think people can see that they're being supported in the workplace, and you can kind of tell people about the RCN. I don't think I ever stop waffling about the RCN, which is good because that's my job. But telling people how amazing it is to have that community. I don't know if you've seen the news over the past 24 hours or so, but certainly Liverpool have had a difficult time. And as soon as things started happening, our representatives kind of came together to ask what we needed and how we needed to help. And that community of reps kind of leapt into action, and we were able to kind of help people right across the region, from supporting people who've had quite a traumatic 24 hours, whether they were at the incident or then in work and then dealing with the aftermath, and then supporting people and our trust to be able to say, actually, you know, we need help here. Can we mobilise people in a certain way? So it's been really useful, and it's certainly a community I will be forever grateful for. Next slide, please. Our health and safety reps are key part of our representative workforce, and they again support members and build those communities of trust and relationships within our patches, and as well the extra kind of training that you will receive, and you do receive an amazing training package. None of this is, you know, expected to be off your own back. We do guide you through the process, but there's an in-depth knowledge of the Health and Safety at Work Act and how that works and how that can be implemented in your own workplace. And so we help improve people's working lives, and we look at hazards and risks. Certainly in my own trust at the moment, we've asked, they're trying to scale back on security, and we've kind of said that that's not appropriate. And our health and safety reps have been in, done a thorough workplace inspection, and to see how that we can keep each other safe. So it's absolutely imperative that we have health and safety reps in our workplaces. Again, they come to our safety committees, and they do a lot of risk management and investigating potential and hazards that the workplace inspections, and say, are amazing, from very basic things to, you know, we'd looked at crumbling estates last year at Congress. We did a whole piece of work on that, and our health and safety representatives were massively involved in making sure that our workplaces are safe for us and, of course, our patients. And again, it comes down to building relationships and getting involved with our RCN campaigns, which is kind of the bedrock of everything that we do. Next slide, please. You have to excuse my voice, I'm really tired. I can hear that I'm growling, so I apologise. Our learning reps are champions of learning and development throughout the workplace, and I think that's something that that we need to concentrate on. You know, nursing and the nursing profession is a lifelong learning journey, and whatever we can do to help that is absolutely amazing. I think sometimes when we're at work, maybe you kind of get embroiled in the day-to-day things, and you know, you do your job, and you and then, you know, you can get home on time if you possibly can. But our learning reps are those people who can kind of recognise people, you know, that this might be something that you're interested in, and kind of signpost people to our RCN learning and development programmes, which are amazing. So it's about, again, signposting, supporting members in their learning journeys, and advocating for that value. I think other professions are very good at championing their learning, and nurses, you know, well, we crack on and do things on our own time, but actually we're allowed to be able to say, I need these things, and this would benefit my workplace and would benefit my patients if I was able to learn in such a way. So our learning reps do amazing things, and you might have seen, if you've been at Congress, some of the workshops that they put in, and they're fantastic. And again, it comes to influencing that learning agenda, and where does the nursing profession need to go to, connecting and building relationships and helping the development of our skilled workforce. So they are absolutely skilled in their own right at helping us to learn and develop. Next slide, please. And the benefits of being a rep, again, as Sanjeet said, kind of building confidence and the kind of personal development. I certainly have been very lucky to meet some amazing people, and I think it's about I like to be inspired, and I like to celebrate people, and I think building that communications right across my trust, and then to other trusts and across our branches, and then therefore across our regions, and then up to council. It's been a huge learning journey for me, and something that I really value. And it's that sense of community, and so people know that you're a representative, and that brings people to you, and you can signpost them to other people. Again, I think communities are massively important for support and for the work that we do. And next slide, please. Yeah, and experience. So I think sometimes people will say to me, oh, I couldn't do what you do. And the reality is that becoming a rep, you know, the RCN's got a great learning package, and we'll take you through that journey, but it's about experience as well. So everybody's lived experience is unique, and our bringing internationally educated nurses into the fold of being a representative brings its own beauty, its own knowledge, because the things that you have experienced, maybe not something that I will have. And so sometimes that lived experience is an extra source of empathy. So it says there, knowledge is power, but experience is empathy. And so maybe you would be better placed to help a colleague through a journey, kind of coming from overseas to the UK, and how all that kind of goes on. And I could say that maybe I can see the journey on paper, but having lived it is something that you can bring an extra string to your bow, and an extra quality. Sometimes we need somebody with that lived experience to be able to say, you know, I've done this, you can do it too, and know the best ways around navigating that process. So I think it's extra important that we have our internationally educated colleagues who can come in and represent, and again build that community, because that's what we want. You are all valid and all valued, and fantastic members of our RCN team, and that's what we want, to be able to make sure that the people know they are cared for and looked after by us. So the diverse communities need diverse workforce, and the skills that you bring are amazing, and that's what we need. We need you to get involved and to come and join the fold, and to bring your expertise with you. Yeah, it says you are our nursing family, and I think that's part of one of the things that makes me do all the different things I do, because I think it's really important to think every single thing that we do comes right back to patient care. So there we go. Thank you very much. I think I'm handing back over to Bejoy.
Hello.
There we go.
So thank you, Carmel and Sanjit and Lena, for your wonderful presentations. And I really wish I knew all of this 14 years ago when I started here. And I was going through an emotional journey, like, you know, of different points in my career where this information could make real difference in my life. So ultimately, if we want to be stronger, we need more of us. And I'm sure, like, you know, all of you are members of RCN, but we need to tell this good things that we do to all the people we know, who would benefit from this. So, I mean, there are things that people doesn't know about RCN that we providing this for our members. So first of all is the professional development. It is just us as a professional body who can support our nurses and healthcare support workers or our student nurses. So we all will benefit from that professional development. And why don't just keep it with us? Share it with your colleagues too. And the next important thing is the workplace support. I mean, I hear loads of stories from everywhere in the country that people needs that have support, but if they are not members of ASEAN, we won't be able to provide that support. So as the only nursing specific trade union in the UK, we can provide that support, and please do share with your colleagues. And legal advice. So we all know how much it costs to get a legal advice. So, I mean, many of our colleagues are really struggling in different aspects of their life. So they need, if they need legal advice, so the members' first point of contact is RCN, and we have the largest in-house nursing, in-house legal team of any UK trade union. And we've got other member support services too: immigration advice, welfare guidance, career coaching, telephone counseling, peer support. And please log into our website. We've got support guidance for different things that really helpful in different places within our work life. So please do make use of our website. And also, we've got extensive career resources and helpful guidances regarding career planning as well. So it's time that, we really engage with RCN. And I'm going to move on to the Q&A session. Please do pop in any of your questions to the Q&A tab.
Hi, Bejoy. So we've got one question in there so far. So please do, everyone, use the Q&A tab. Make the most of having these fantastic speakers to ask your questions. Our first one, I'm going to come to Lena on this one. Based on the standards, what's the nurse-patient ratio for general and specialty ward?
So,
big question.
I know it's a big question. Currently, we don't have any ratios that say this is what you need to do when you work in any specialty. So we're doing a big piece of work around building that evidence and giving some guidance. But we know that from the NICE review, if you look after more than 8 patients, that increase the risk. So that was back in 2013. So we still need to give the evidence, and it's very difficult because we don't uniquely have a ward or department with similar patients anymore. And I'm sure you guys can all attest to that. You'll be running an elderly care ward, but you'll have very acutely unwell patients. So it's difficult to get a ratio, and we don't have one. But a long story short, we're working on that. But in America or in Australia, you're looking at 1 to 4 ratios. So there's still a long way to go in terms of the UK ratios currently. Thank you.
And I just want to add, RCN is working really hard to get safe staffing into the legislation. So there are work that already happening, but it just hasn't completed.
Yeah. Our next question is from Leslie about, can you have time off from work to do all the rep advocacy? So Carmel, are you able to come in on that one, please?
I certainly will. So as representative, there is, we would kind of expect that you would be given facilities time, and probably enshrined in law as a health and safety rep, and it's kind of easier to push that agenda that you would be able to have time. But certainly my trust gives me 2 days a week, so I do 2 long days clinical and 2 days a week for the RCN, and that is for me to kind of manage my case management, or a little bit more involved now that I'm chair of council. But certainly each staff side group would have kind of a pot of time, and then you would be able to kind of apply for that, and that's where you would be able to kind of mix that time from. And of course there's lots of other activities that are available. I have a branch meeting after this, and that kind of comes out of my time for the week. So yeah, there is time available there, and we need to do more for our reps to make sure that everybody has the time that they're needed, and that's something that I am extremely passionate about, because I think all of us need more time. There needs to be more hours in the day, but definitely the more of us that kind of stand up and shout and say we need time for our reps to help people, then the better we will be with that. So again, it's about being part of that community and shouting loud and proud that we need to be able to come together and to do this. Does that make sense?
Perfect. Thank you very much, Carmel. Our next question is, how many reps or stewards do you need in an NHS trust? So I'll take a little pop at this if that's okay. Hi everyone, my name's Harry and I'm the head of activist engagement. I mean, really, we want to make sure that every member has access to a rep. We know workplaces look different, some trusts and different sites within that trust, but we want every member to have access to a health and safety rep, to a steward and to a learning rep. So there's not necessarily a set number, but we want to make sure that there are, every member has access. So if you work in a trust where you don't have one of those three, consider signing up today. If you don't have a couple of those three, grab a friend and sign up as well. I don't know if anyone else has got anything they'd like to say on that one.
More. We need more of us.
More reps, yeah, exactly. Fantastic. That's it from those questions, but I can also see a couple in the chat. So I see one from Rachel asking about, can we be an RCN standards champion if we stop working as a nurse? So that I think that the standards are something that I think all members can use, but I'll go to Lena for that question, please.
Yes, absolutely. Anyone that is interested in supporting nurses and the nursing support worker or students can be a champion. One of my champions is actually a recruiter of nurses, and she went on to become a champion because she could see the value in improving conditions for the agency nurses that she sends across, and she became a champion. So if you're interested in supporting nursing staff, then you can be a champion. Thank you.
Brilliant, thank you. There's a couple of questions coming in now. I just on that one, Bassam, it was the facilities time. You'll be supported to negotiate that with your employer, and that's worked out on a couple of different things on how many members and how many reps you have as well. So it's kind of done on a case by case basis. And as Carmel said, we will always try and push to maximise that as best as possible. The difference between a rep and a workforce champion is one of the questions. Carmel or Lena?
We have, I'll talk about the interface. So you can be both. And we have some of our reps that are champions. And then we have some champions who started with a champion and then now they are reps. So you could do both roles, but Carmel might want to add something else.
Yeah, I'm both, and we kind of do slightly different things, and the representation. So as I say, I'm a steward, so I directly represent people who've got workplace issues. So whether that be kind of sickness and absence reviews, or maybe formal procedures like disciplinaries or grievances. So that's part of my training. I do that, and the workforce champion kind of role is within everything. It's kind of the golden thread that kind of pulls everything together, and so you can kind of do as much as you can, and both are very, very valid and valued roles. So I would encourage everybody to get involved with that. And it would be my ultimate dream, my magic wand, is to say that everybody will be clamoring to kind of become a rep, and straight after this you're all going to sign up and you're all going to come and join us, and then we've got a huge community right across the land supporting our members and therefore our patients.
And whilst you're there, Carmel, and there's another question asking about, if you sign up to become a rep, do you get training so that you can be effective in that role?
Oh, 100%. So there's an expression of interest form, I think it's on the website, and you kind of go through that and kind of maybe have a look properly at all the different roles and maybe see where you would best kind of fit. I do like my health and safety stuff, and I will probably do that training later on in my career. I'm a little bit busy right now with the chair of council gig, but I do like being a steward, and I like that kind of direct representation. So find where you fit and where you like, and fill in that form, and then there is a full learning pathway there for you. And our team are amazing, and they will give you all the help that you need. And I think on my training we did like excuse me, we did scenarios and we did kind of workshops where we did kind of fake representation kind of stuff, and it was really, really invaluable. Our trainers are amazing and will take you through that journey, I promise.
Brilliant, thank you. There's a question here, which is more about which I imagine this might be one that is on the mind of a lot of people about the RCN and their position with the changes in immigration rules. And for anyone who was at Congress, I know this was something that was spoken about, and I think it came across really loud. I don't know if we'll have those answers necessarily today. Carmel, I don't know if there's any space for that or somewhere to keep an eye on updates.
I would recommend that, like, we have a report that published unreciprocated care. So why don't we pop that in the chat, because it tells detailedly about our position, because I am mindful of time. We don't have time to discuss, but it's very detailed and, would give all the information that you need.
Thanks, Bejoy. And it's something that we are really passionate about, and Bejoy and I, in our roles in council, are certainly doing all we can to stand for the things that, we talked about in Congress, to remove that no recourse for benefits, to help people through the process, because as I've said before, our internationally educated nurses are valid and valued and part of our community and part of our nursing teams, and you should be treated as such. So it's something that we are very passionate about, I promise.
Yeah.
Brilliant.
And
thank
we are
you.
against unnecessarily separating families.
Yeah.
So
yeah, absolutely. That just shouldn't be a thing. So we are doing all that we can to call for the government to stop that kind of those shenanigans.
Thank you both. So we're going to move to our closing remarks now. The only final questions I can see in there were about the process and the types of rep. There's 3 types of rep, and there is a process. What I'll do is get one of my colleagues to pop a link that shows you clearly the types of rep and the process, so you can have a look. And I'm going to hand over to Bejoy. Thank you very much.
thank you. Thank you all for your input today. I hope this has been a really helpful discussion for all of you. So, as internationally educated nurses, we know what it means to work hard, harder than most, just to be seen, just to be valued. We've crossed borders, learned new systems, and served with heart and skill. But let's be honest, that dedication has not been matched with fair pay or recognition. We need to make sure our voices are heard. Register to be the voting members today if you work in the NHS in England or Wales. We must organize, we must mobilize, and we must help others to do the same. If you volunteer to get out the vote in the next pay consultation, you'll be helping to amplify voices that have too long been ignored. We must stand together, not just as nurses, but as workers, as immigrants, as people who believe that dignity and fair pay are not privileges, they are rights. So before we finish, I want to leave you with something I talked about at RCN Congress a couple of weeks ago. All of you are the voice of the RCN. I believe that the RCN will always be stronger by more closely reflecting the diversity of the profession, because I believe in the strength of our collective voices, and it's important that voices are heard from across nursing. Here is what I believe. We have the power to influence change. Let's not wait for election season to make our voices heard. Decision makers needs to hear from us year round. Because the real change happens when we consistently engage, share our concerns, and shape their thinking every step of the way. And it is challenging time for internationally educated nursing staff in the UK. You may have heard the Prime Minister's announcement on immigration a few weeks ago, but the RCN believes we need an immigration system that works for care staff, nurses, and the people who rely on them. At Congress, as I mentioned earlier, we launched a new report, Unreciprocated Care, Why International Nursing Staff Are Leaving the UK. In this report, we are demanding the UK government removes the hostile immigration policies that face internationally trained nursing staff when they come to the UK. We should be welcomed, not penalized. All of you here and all of our internationally educated colleagues are valued part of the UK workforce. And please do remember to share this with all our colleagues. And our next session is on organizing for the profession on 26th of June. Please do promote this among our colleagues so that we can be one force, one united voice under ASEAN banner for all of us together. Thank you.